name is Diane Beck, and this is a TFT technique for anxiety. Roger Callahan, who created TFT, which is one of the therapies which I often use and which is what this is based on, he came up with these amazing techniques which are kind of electrosensory, the pressure point tapping, and they're instant, and they can have profound effects on how you're feeling and experiencing an emotion like anxiety. And because it can feel so visceral, and everybody's anxiety or everybody's panic is individual to them and experienced differently in every single person. No two people do panic the same, because it's yours. It's your signals, your body going, hey, something's wrong, something's wrong. So you've got to listen to it. This is not a distracting technique. When your body's shouting to you, saying something is wrong, something is incongruous to what I'm happy with, you know, something is out of the bounds of what I consider safe for me, that you want to listen to it. Certainly you want to question it, but that can take you down quite an advanced route. And get in touch with me if you want to go down that route, and we can certainly get to the root cause of it. So if you're about to go into an interview, or if you're about to board a flight or another travel, or whatever it is you're going to do, or if you're generally feeling anxious, take a moment to ascertain maybe what number it is on a scale of 1 to 10. 10 being the most intense it can be. 0, can't even be bothered to even be bothered to think about it. 0 is nothing. Great, that's where we want it to get to. So on a scale of 1 to 10, how anxious you feel, and how much you agree with the fact that you're very anxious right now. Maybe it's an 8. So what we do is I want you to do the triangle, which is in another video. I'd also like you to do the collarbone breathing. It doesn't have to be in that order, it can be after this technique too. But I want you to just tap the side of your hand for now for me. And I want you to tap underneath your eye on the orbital bone here. Tap, 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 tap. Either side's fine. In fact, you can do both. Why not? Let's do both. Tap, 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 tap. Collarbone point. Where a gorilla pounds, and underneath the knuckles of the collarbone, I want you to tap in there. Tap, 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 tap. And you might notice your breathing changes. All the time, thinking about whereabouts in the body you're locating the anxiety underneath the eyes again. Then I want you to find what we call the gamut spot, which is between the little knuckle and the next knuckle along. The indent, I want you to tap in there. Keep tapping, okay? I want you to keep your head really still. Your eyes are going to move. So I want you to close your eyes. Open your eyes. Look down sharply, corner left. Centre. Sharply, corner right. Centre. Roll your eyes in one direction, the periphery of your vision, right the way around, like you're following a pencil, and then all the way around the other way. Keep tapping all the while, and then hum a tune, happy birthday. Count to 5 very quickly, 1, 2, 3, 4, 5. Hum a tune again. And then we're going to start the tapping again. Side of the hand. Underneath the eyes. Oh, I was thinking about the anxiety, whereabouts it is in the body. Whereabouts are you kind of feeling it? Where's it located directly? Is it in the stomach? Is it in the guts? Is it in the chest? Is it in your head? Is it in your throat? Locate where it is for you. Collarbones. Underneath the eyes. And now scale it after you've done that. Stop and think about the anxiety. If there's any anger involved, if there's trauma involved, I want you to redo this algorithm, which was underneath the eye, collarbone, underneath the eye. I want you to do underneath the eye, collarbone, if there's trauma involved. I want you to tap the beginning of your eyebrow, where it begins from your nose, underneath your eye, underneath your arm, where a woman's bra strap would be, and then collarbone. And then again do what we call the 9 gamut sequence, which is tap, 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 close eyes, open eyes, down one way, down the other way, roll, roll, hum, count, hum, and then repeat that. If there's anger in with that, I want you to do underneath the eye, collarbone, underneath the eye, inside the little finger, collarbone, and then do the 9 gamut sequence. If there's rage involved with that, I want you to be tapping underneath the eye, collarbone, underneath the eye, outside corner of the eye, underneath the eye, collarbone, underneath the arm, collarbone, and then the 9 gamut sequence again. Have a play around with those. Like I say, it's very basic, but the basic can be the best sometimes. The basic can be the one that kind of nails it, and often can be in session too. Let me know how you get on with it. Good luck with it. Like I say, it's very, very simple TFT, electrosensory. It's brilliant how it works, and similar in many respects to Havening, this newer, most fantastic of therapies that works on the amygdala. So yeah, have a think about how it is you want to apply it. Rescale it all the time, kind of think whereabouts is my number, is it kind of moving down, and keep doing it till it's a 0. With those techniques on the anger and the trauma associated with your anxiety, because maybe you've got frustration involved in there, there's frustration involved in there, little finger, middle finger, gamut spots, and do the 9 gamut sequence. All of these combinations are great, so that's like that again is little finger, middle finger for frustration, and back of the hand, gamut sequence. And go through the 9 gamut sequence, close eye, open eye, after all of these little combinations, and rescale it all the time until you get to as close to a 0 as possible. Have a look at my videos on collarbone breathing again, which is another great one to add to it, and also the triangle technique, the PR triangle, brilliant technique. Knocks out so many SUD numbers, subjective units of distress, what we call it, scale of 1 to 10, and knocks out those numbers a lot of the time, can bring you right down before we've really done anything. I would usually kind of do a triangle technique with most of my clients that come in just to calm them down from the nerves of coming to see me or seeing me on Skype. So try it out. Check out my website, health-success.co.uk, and there's lots on there about TFT, NLP, Havening, reflective repatterning, brilliant, hypnosis, and how all of these techniques, in varying degrees, can be bespoke to you to eliminate lots of issues, and these in particular are really useful for you to take away. So I hope you've enjoyed the video. Thank you for watching, and check out my other ones.